Hey there, and welcome to your NCLEX-RN preparation session. Get ready to take your exam preparation to the next level with these practice questions. On your screen, you'll see two main sections, the question on the left and the answer choices on the right. But here's where it gets interesting. I'll read each question out loud, and as I do, you'll see a red highlighter moving along, keeping you focused on exactly what matters. Once I finish reading the question, you'll have some time to think through your answer. Keep an eye on the timer in the top right corner. It's your countdown to make the right choice. When the timer hits 0, we'll break down each option together. I'll show you why the correct answer is spot on, and we'll dive into why the other choices just don't fit. Plus, I'll share some pro strategies to help you tackle questions like a true NCLEX champion. Ready to crush it? Let's dive in. Let's see another question. Mr. Smith, a 65-year-old male, presents to the emergency department with complaints of fever, productive cough with greenish sputum, chest pain, and shortness of breath for the past 3 days. He reports a history of smoking and occasional alcohol consumption. On examination, he appears lethargic with increased respiratory rate and decreased breath sounds on the right lower lobe of the lung. Chest X-ray reveals consolidation in the right lower lobe consistent with pneumonia. Which of the following statements of the patient is consistent with the diagnosis of pneumonia? A. I have been experiencing a dry cough for the past few days. B. My sputum is yellowish in color. C. I have not experienced any fever or chest pain. D. I have a history of smoking. E. I have not been feeling short of breath. F. I have been experiencing nausea and vomiting. I'll give you some time to go through the question and each of the options. You can pause the video as well if you need more time. All right, let me explain the answers to you. B. My sputum is yellowish in color. This statement is consistent with pneumonia, as greenish or yellowish sputum is a common symptom due to the presence of pus in the airways. D. I have a history of smoking. A history of smoking increases the risk of developing pneumonia as it weakens the immune system and damages the respiratory tract, making individuals more susceptible to infections. Options A, C, E, and F are incorrect. Option A. I have been experiencing a dry cough for the past few days. While cough is a common symptom of pneumonia, a productive cough with greenish sputum is more indicative of pneumonia than a dry cough. Option C. I have not experienced any fever or chest pain. Fever and chest pain are common symptoms of pneumonia. The absence of these symptoms makes this statement inconsistent with the diagnosis. Option E. I have not been feeling short of breath. Shortness of breath is a common symptom of pneumonia due to the inflammation and infection in the lungs. The presence of shortness of breath is more indicative of pneumonia. Option F. I have been experiencing nausea and vomiting. Nausea and vomiting are not typical symptoms of pneumonia. These symptoms may suggest other conditions such as gastrointestinal issues. Let's see another question. By the way, the strategies we've been talking about in this video, those approaches for tackling tricky NCLEX questions and managing the different types of questions are actually taken straight from a resource I really recommend. The new NCLEX-RN Practice Question Bank. If you're looking for a great way to practice and apply those strategies, this book has over 700 questions that mimic the real exam format, and each one comes with detailed explanations that help you understand exactly why the correct answer is right and why the others aren't. It's a great way to reinforce the strategies we've been covering here today. This book is especially useful if you're struggling with the new next-generation NCLEX format or just need a structured way to build up your confidence with daily practice. You'll find it's all about practicing smart, not just hard, and really honing your test-taking skills. So, if these strategies are helping you out, this book could be a solid next step to boost your preparation even further. Just thought I'd share that in case it's something you want to check out. You've got this. Sarah, a 35-year-old woman, presents to the emergency department with complaints of difficulty breathing, chest tightness, and coughing. She reports a history of asthma and allergies. Upon examination, the healthcare provider hears wheezing during expiration. Sarah's vital signs are within normal limits, but she appears anxious. What is the primary significance of wheezing in respiratory assessment? The given options are A. Indicates normal, healthy airflow through the smaller airways. B. Signals upper airway obstruction. C. Suggests fluid in the airways. D. Alerts to potential airway obstructions. E. Resonates over the large airways indicating upper respiratory tract abnormalities. I'll give you some time to go through the answers. The correct answer to this question is D, or alerts to potential airway obstructions. Option A is incorrect. Vesicular breath sounds indicate normal, healthy airflow through the smaller airways and alveoli, not wheezing. Option B is also incorrect. Stridor, not wheezing, is a harsh vibratory sound signaling upper airway obstruction. Option C is also incorrect. Crackles, fine or coarse, suggest fluid in the airways, not wheezing. Option D is correct. Wheezing, characterized by a high-pitched whistling sound, alerts healthcare providers to potential airway obstructions, often associated with conditions like asthma, COPD, or bronchitis. Option E is incorrect. Bronchial breath sounds resonate over the large airways, but wheezing is not described as bronchial breath sounds. Let us go through a quick question once again. Sarah, a 35-year-old female, presents to the emergency department complaining of shortness of breath and wheezing. She has a history of asthma and seasonal allergies. Upon auscultation, the healthcare provider notes audible wheezing during expiration. Which of the following conditions is most commonly associated with wheezing? The options given to you are A. Pneumonia, B. Pulmonary embolism, C. Asthma, D. Pleural effusion, E. Pulmonary fibrosis. I will give you some time to go through the answer. The correct answer is C, or asthma. Wheezing is a high-pitched whistling sound heard during expiration or sometimes inspiration and is a hallmark symptom of asthma. It occurs due to narrowing of the bronchial tubes, leading to airflow obstruction and turbulence. Patients with asthma commonly experience wheezing during episodes of bronchoconstriction triggered by various stimuli such as allergens, exercise, or respiratory infections. Other options. Option A, or pneumonia, is incorrect because pneumonia typically presents with crackles or rales on auscultation due to the presence of fluid or inflammation in the alveoli. Option B, or pulmonary embolism, is incorrect because pulmonary embolism may present with tachypnea and pleuritic chest pain but does not typically produce wheezing on auscultation. Option D, or pleural effusion, is incorrect because pleural effusion results in decreased breath sounds over the affected area and may present with dullness to percussion, but wheezing is not a common finding. Option E, or pulmonary fibrosis, is incorrect because pulmonary fibrosis is characterized by progressive scarring of lung tissue, which leads to restrictive lung disease. It typically presents with fine inspiratory crackles rather than wheezing. If you have learned something from this question, let me take you for another practice question. Emily, a 28-year-old woman, presents to the emergency department with complaints of worsening shortness of breath, wheezing, and chest tightness. She has a history of asthma and reports recent exposure to her cat, a known trigger for her asthma exacerbations. Upon assessment, Emily's respiratory rate is 24 breaths per minute, and she appears anxious and diaphoretic. Auscultation reveals widespread wheezing throughout the lung fields. During an asthma exacerbation, which position is recommended for optimal management of respiratory distress? Your options are Option A, lying flat on the back with legs elevated. Option B, lying flat on the stomach with arms extended. Option C, sitting upright with feet flat on the floor. Option D, lying on the left side with legs bent. Option E, standing with hands resting on a table. I will give you some time to go through the question. Option C, or sitting upright with feet flat on the floor, is the correct answer because during an asthma exacerbation, the patient should be placed in an upright position, such as sitting upright with their feet flat on the floor. This position helps to expand the chest cavity, improve lung ventilation, and alleviate respiratory distress by allowing the airways to remain open. Option A, or lying flat on the back with legs elevated, is incorrect because this position may increase pressure on the chest and abdomen, making breathing more difficult for the patient during an asthma exacerbation. Option B, or lying flat on the stomach with arms extended, is incorrect because lying flat on the stomach does not facilitate optimal lung expansion and may further compromise respiratory function, especially in individuals experiencing asthma exacerbations. Option D, lying on the left side with legs bent, is incorrect because while lying on the side may improve comfort for some patients, it does not provide the same level of chest expansion and airway clearance as sitting upright. Option E, standing with hands resting on a table, is incorrect because while standing may offer some relief for patients with mild asthma symptoms, it may not be practical or comfortable during an exacerbation, and it does not provide the same benefits as sitting upright with feet flat on the floor. Sitting upright with feet flat on the floor is the preferred position for managing asthma exacerbations as it optimizes lung function, promotes airway clearance, and improves patient comfort. This positioning allows for better delivery of inhaled medications and facilitates effective treatment of acute respiratory distress associated with asthma. Let us see another practice question. A patient with asthma is prescribed Theophylline to manage their symptoms. The patient is experiencing gastric irritation as a side effect of the medication. What is the nursing management approach to address the patient's gastric irritation? Your options are A, Administer the medication via IV. Vish or break the medication. C. Administer the medication with food and educate the patient not to take it on an empty stomach. D. Administer the medication at irregular intervals. Please take your time to go through to select the right answer. All right, let me reveal the right answer to you. The right answer is C. Administer the medication with food and educate the patient not to take it on an empty stomach. Administering the medication with food and educating the patient not to take it on an empty stomach helps to protect the drug from the acidic environment of the stomach and minimizes the risk of gastric irritation. Theophylline is a bronchodilator that relaxes the smooth muscles in the bronchial airways and pulmonary blood vessels. It is used to treat symptoms of lung conditions that block the airways, such as emphysema or chronic bronchitis, and is taken orally. The drug can cause side effects such as gastric irritation, tachycardia, insomnia, restlessness, confusion, and dysrhythmias. To minimize the risk of gastric irritation, it is important to administer the medication with food and educate the patient not to take it on an empty stomach. The enteric-coated tablet form of the medication is also designed to protect it from the acidic environment of the stomach and should not be crushed or broken while administered to the patient. The drug should also be given at regular intervals to achieve a normal therapeutic level, and patients taking the drug should avoid cigarettes, tea, coffee, and chocolate as they can worsen respiratory conditions. It is important to monitor for drug interactions, as theophylline should not be given with antibiotics like ciprofloxacin or cimetidine, as they can disturb the absorption of the drug and increase the risk of toxicity. If theophylline is administered via IV, it should be done slowly via an infusion pump. Let me take you to the next question. Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX-RN. I know how stressful it can be, especially when you're balancing everything: clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX-RN questions and answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and, most importantly, help you feel more ready. Good luck. You've got this. A patient is diagnosed with severe asthma and is prescribed a glucocorticoid drug to manage the condition. The patient is given the following options to choose from. The given options are A. Viclomisone, B. Prednisone, C. Fluticasone, D. Mometasone furoate, E. Butanide. The patient wants to know which option is the best choice for long-term treatment of their asthma. I'll give you some time to go through the answers. All options are glucocorticoids and can be used for long-term treatment of asthma. To determine the best option for the patient, it is important to understand the properties of glucocorticoids and their potential side effects. All options listed at the E are glucocorticoids that are used for long-term treatment of asthma and other restrictive airway disorders. Therefore, any of the options could be a suitable choice for the patient. All options listed in the question, options at the E, are examples of drugs that belong to the class of glucocorticoids. These drugs are used to treat restrictive airway disorders such as asthma and COPD and are not typically used for short-term or emergency treatment. They work by blocking muscarinic receptors in the bronchioles, causing bronchodilation and relieving symptoms of air restriction. However, they also have sympathomimetic properties, which can cause side effects such as palpitations, tachycardia, hypertension, constipation, blurred vision, dry mouth, urinary retention, and drying of body secretions. One of the most significant side effects of glucocorticoids is immunosuppression, which can increase the risk of infections, particularly in the mouth. Therefore, it is important for patients taking these drugs to take good care of their oral health.